we have this giant Republican bill, which represents almost all of their agenda, where they want to give tax cuts to the rich and pay for them on the backs of the poor. And it's really as simple as that. Ordinary people who are beneficiaries will have to pay more for the services.
Hey, it's Jordan. I am in Flint, Michigan, East Palestine, Ohio, Tumwa, Iowa. Please support the only independent outlet on the ground covering what the corporate media covers up.
Hey, this is Ashley Bishop with Status Coup. I am extremely excited to be joined today by David Dayen, executive editor of The American Prospect. David has a new piece up this morning in the Prospect. Medicaid cuts in Republican bill would charge poor people more for coverage. Again, I'm really glad to have you here to talk us through this. So just to give a little bit of background, the Prospect has seen parts of the budget reconciliation bill that is being proposed by Republicans. And again, your piece is focusing on the proposed cuts to Medicaid in the bill. So can you walk us through a little bit of what you found looking through that?
Yeah. So what we know is that Republicans in their reconciliation instructions said that the Energy and Commerce Committee, which handles a lot of the healthcare stuff, has to find $880 billion in cuts over 10 years in the bill. And they haven't quite done so, but what they have done is pretty punitive. Obviously, Republicans are dealing with a hardliner faction that wants as many cuts as possible, and a moderate faction that is worried, especially those for whom Medicaid is a major healthcare program in their districts. They're wary of cuts, and they have said, "Oh, we're only going to do waste, fraud, and abuse, and we're not going to cut benefits for anybody." Well, the big thing here in the bill is that it would add what is euphemistically called cost sharing to people who make above the federal poverty line and are on Medicaid. What cost sharing means is that ordinary people who are beneficiaries will have to pay more for the services that they get in Medicaid. That could mean a premium. Usually there's not a premium in Medicaid. Particularly people usually are protected from that. It could mean co-pays. So you go to the doctor, you got to pay $10, $15, $30, whatever. It could mean a variety of fees and things like that. And basically, they're just gathering money on people who are the most vulnerable in society. I mean, the federal poverty level right now is $15,000, $15,650 for an individual, or something like $21,000 for a couple. So anyone making more than that would be subject to these cost-sharing measures. And, that's not a lot of money to have to also kick in when you're on Medicaid for additional funds in order to be able to get your healthcare coverage. What it's probably going to mean is either less disposable income for individuals, or they'll forego coverage because they can't afford the copay. So it's going to mean less utilization of healthcare. And so it's not just the money that the government gets savings from, it's the fact that people might use less healthcare. And therefore, they'll save on those treatment costs.
Absolutely. I mean, that's just insane. And there are roughly like 74 million Americans who are currently enrolled in Medicaid. And I think there's like 7 million additional Americans who are enrolled in, I think, CHIPS, so coverage for children. So, I mean, that is a huge proportion of people in this country. And if we're talking about, increasing costs to people who are above the federal poverty line, you said that's $15,000. I don't know how anyone anywhere in the country survives by themselves on $15,000 or, $20,000, $21,000, $22,000 for two people. So adding additional costs to these people's lives, like it's, I don't know. The president was, no, go ahead.
Well, and it breaks this sort of red line that moderates have had, where they said, look, we'll go after waste in the system, but we're not going to do anything that hampers the coverage that people have. And so what people have to know is that, that's what these moderate Republicans, alleged moderate Republicans, said. And now they're preparing to go forward with a bill that does just that. So the question is, a dozen Republicans said, we're not going to vote for anything that does this. So are they going to be true to their word? I mean, that's one of the big things. But that's not the only thing in terms of Medicaid cuts that's in the bill. One of the big items is work requirements. And that means that what are called able-bodied adults would have to work in order to get Medicaid. And this isn't totally about getting more jobs. The fact of the matter is that 61% of people on Medicaid already work. The goal here is to make it harder to enroll and to make it more convoluted to enroll. There's another piece that changes a Biden era rule that made it easier for eligibility purposes and easier to enroll, and they want to repeal that. So the goal is, it's kind of like when, in the days before the Affordable Care Act, they put the insurance office on the 7th floor with no elevator. So you'd have to walk up all these steps to get to the insurance office so you wouldn't get insurance. That's the goal here, is to put in a bunch of hurdles so that it's harder to get Medicaid and it's harder to stay on Medicaid. One of the things that's going to be done is there was a change that Biden did that said the redetermination process, where your eligibility is checked again. Oh, are you eligible now for Medicaid? That was done once a year under this Biden package. They would change that to every 6 months. And it's just to attempt to kick people off the Medicaid rolls in a more efficient fashion, So that's kind of the purpose of a lot of these other elements of the bill. And then the other one that I think is really noteworthy is under the Biden administration, they put in what was called the safe staffing rule. And this was a rule that added a certain minimum number of nurses and nurse practitioners in nursing homes. And nursing homes, a lot of people in there are on Medicaid, because Medicaid, unlike other federal programs, picks up the cost of nursing home care. So now the Republican bill would repeal that safe staffing rule, which makes things much more dangerous. They derive some minor savings from this, probably because they don't have to vet all these nursing homes and just undergo the compliance standards and implement the regulation. It's a very small amount of money, but what it really does is it makes it more dangerous to be in a nursing home, because there will be less supervision of the people who are in there. So, the nickel and diming that's happening in this bill, it has a dramatic impact on people's lives.
Absolutely. I mean, again, just to kind of underscore what you're saying here, as far as reducing staffing in nursing homes, we're talking about people's grandparents that need care, that have been placed in these care facilities because they cannot be left alone. My grandparents were in care facilities before they passed, and it's, I don't know. Like you said, we're not actually saving.
And keep in mind what you have to do to qualify for Medicaid if you're elderly and want nursing home care. You have to draw down all the money that you have. You have to have essentially no assets. In addition to not having, a generous enough Social Security package, or not having, there's an income level, but you have to have essentially no assets. So there are people who otherwise couldn't afford nursing home care at all, who essentially draw down all the money that they have and go bankrupt in order to get into a nursing home. And now what we're telling them is, oh, you won't actually be cared for as well in that nursing home as you otherwise would under previous regulations. So it's really a crazy set of circumstances.
It really is. And again, talking about what we're actually saving here. So the goal was to save $880 billion through cutting Medicaid. They have managed to get to, I think, 600 billion.
Yeah, I mean, that's the overall package. The Medicaid part of it is probably no more than 500 billion.
Okay.
And that's over 10 years. You know, the way that we do budget math is you look at it over a decade. So, you know, some of these cuts are very small, but they're going to have a very big impact. One good example is the cuts to the District of Columbia's federal share. So the way Medicaid works is a federal state program, and the federal government pays some and the states pay some. And right now, by statute, District of Columbia has the federal government pays 70% of the Medicaid program in DC, and DC pays 30%. And they want to just cut that and go by this other formula that would make it probably more like 50% share. So that cuts $8 billion over 10 years, which is nothing in the overall scheme of the federal budget. But it's an $800 million annual cut to DC, which is already struggling because there was $1 billion cut that was put in the continuing resolution to fund the government. So that's about $1,000 for every man, woman, and child in the District of Columbia. And where they're going to find that money, it's impossible to know. But what it's probably going to mean is they're going to have to make their Medicaid program stingier and throw people off the rolls. So the real world impact of a lot of this stuff is that fewer people are going to be on Medicaid, which probably means that fewer people are going to have health care at all, because it's not like they can afford insurance in the private market. So that's the real stakes here, is that we're going to see a lot of people not have insurance coverage. And what we know is that when a lot of people don't have insurance coverage, some of them die. And you know, sometimes we want to be polite and we don't want to say what the real impact of this is, but that's what it is. People die when they don't have insurance coverage. And the Republican bill is designed by design to make sure that fewer people in America have insurance coverage.
Absolutely. And I think that that's probably, you know, the most important thing to take away from this is that when we're talking about, you know, cuts to Medicaid or any of these other things, we're talking about working people. We are talking about people's lives, and not just like people's lives and livelihoods. It's the ability to afford potentially life-saving medication or medication for chronic diseases. If you don't get things like that, your quality of life will dramatically increase if you're, again, not being treated for any kind of disease that you have. And like you said, people could die. And
I should add that this interconnects with some other cuts that we found that are going to be in the bill. One, to the Affordable Care Act marketplace, which is where people who maybe make a little more and don't qualify for Medicaid, but are still, you know, basically the working poor that are struggling to afford their lives. That could raise out-of-pocket costs for millions of enrollees on the Affordable Care Act exchanges. And there also are planning to be cuts to two components of welfare: temporary assistance for needy families, or TANF, and the social services block grant. And this is, you know, cash assistance for the neediest people in the country. And so it's not enough that we're cutting Medicaid, but there are all these cuts to other programs that assist working people and particularly poor working people that are going to be part of this bill. And, you know, once again, you have to ask these Republicans who said, we don't want to hurt people with this bill. That's what that's what it's going to do. And, you know, it's a gut check moment for them as to whether they're going to go along with it.
Absolutely. And you know, along that line, so in a letter in April, you know, a bunch of moderate Republicans, I think there were 12, sent a letter to, you know, among other people, Speaker of the House, Mike Johnson, and they said, we cannot and will not support a final reconciliation bill that includes any reduction in Medicaid coverage for vulnerable populations. And as you know, we're talking about this, what do you think that these people do? Because they have, you know, drawn a line in the sand, publicly. They said they cannot and will not support these cuts or support a bill that includes these cuts. What do you think they do now? And, you know, they're not the only Republicans who have said we are not going to touch Medicaid. So
Right. I think you're going to see a lot of gaslighting. I think you're going to see a lot of people saying that a Medicaid cut isn't really a Medicaid cut. I think you're going to see a lot of logical leaps and pretzel logic to try to talk themselves into this. What we've seen over and over again is that moderate Republicans do not hold the line on the things that they say are red lines for them. And maybe they'll prove me wrong this time. And frankly, for the benefit of poor people who need this healthcare coverage, I hope they do. But you know, the recent history of this shows that when push comes to shove, when their arms get twisted by Mike Johnson and his other colleagues, that they cave. And you know, I think there's going to be a lot of hoop jumping to say that when someone making $15,500 a year has to pay a premium or pay more in a copay, that's not a cut to vulnerable populations, and that's going to be a bit hard to swallow. And I think Democrats are ready to jump at the chance of this. There was they put out a letter today, Democrats. They got some guidance from the Congressional Budget Office on what some of the proposed cuts to Medicaid would do. And they didn't really look at the right things, but the one thing that is in the bill is the repeal of this Biden era enrollment and eligibility rule. And that, according to the Congressional Budget Office, which is the nonpartisan budget scorekeepers, it said that would kick 2 million people out of Medicaid. And so right there, I think vulnerable populations are absolutely going to be affected by what's in this bill. And that's just one component of it.
Absolutely. And, you know, I want to talk about the Democrats, you know, potential response to all of this. But I also want to ask, you know, so if we are to believe that DOGE is focused on waste, fraud, and abuse, we should know that there was a 2020 study in The Lancet that found a single-payer program like Medicare for All would save more than $450 billion and would likely prevent 68,000 deaths every year. And the Congressional Budget Office also found that a single payer system would yield some $650 billion in savings in 2030. So if we are supposed to believe that what they're actually trying to do here is save Americans money, it seems like we actually have a better option. It seems like they should be following the lead of Senator Bernie Sanders, because it would appear that we would get more savings and cover more people by having a single payer system than cutting care from the most vulnerable parts of our population.
100%. And, you know, they don't go after the biggest source of waste in the entire system, and that's the privatization of Medicare, which has led to not only under delivery of coverage, but overbilling. That even nonpartisan organizations like the Medicare Payment Advisory Board has shown cost something like $100 billion every year. So that would be, you know, using the budget math of 10 years, that would be $1 trillion or more that is just given away to private companies who have privatized Medicare and who use these various machinations. One of them is called upcoding, where they make their patient populations look sicker than they actually are because they get a premium, more reimbursement when they are dealing with sicker patients. So they just put these little codes in that says, oh, this person has hypothermia, this person has distension or whatever. And they don't, but they game this system to gather more money from the Medicaid program. And it's a very common thing. It's very well known, but there are no changes to Medicare, including changes to Medicare Advantage, which is the privatization of Medicare, in this bill. So the biggest, fattest source of waste, fraud, and abuse in the entire healthcare program managed by the government is untouched in this bill. And yet we're going to raise a premium on somebody who makes like $8 an hour.
Which is crazy. And you know, to come back to the Democrats and their response to this, what do you think the Democrats can or should do here? You know, it sounds like their response already has been inadequate. I expect their response is going to be inadequate. What do you think they can or should do?
I mean, they have highlighted Medicaid in a pretty big way throughout this process. Also, another thing that's up for cuts, which is SNAP, which is the Supplemental Nutritional Assistance Program, or food stamps, as it's commonly known. So they have been talking about that. They've been talking about Medicaid, they've been talking about SNAP, challenging Republicans, particularly the ones who have said they're not going to make any cuts to the bill, trying to lean on them and say this is your career on the line. That's generally what they can do. This process goes of budget reconciliation means that they don't Republicans don't have to worry about the filibuster, so they can pass this bill all by themselves. And that is very much possible for them. And so Democrats really only have the option of pressuring Republicans into, warning them of the consequences of their decision. And so I think that's something we'll continue to see.
Absolutely. And if the Democrats are able to, have some kind of response to this, like you're suggesting, that people will find compelling, adequate, in the face of cutbacks and rising fascism and all of that. You do have people like Tim Walz saying that if Democrats are able to, get back in power after the midterms, after this next election, people are going to expect more from them, especially as far as things like medical coverage. And, we're talking about insurance in the wake of things like Luigi Mangioni's court case that's, ongoing right now. Do you think that the Democrats will have a plan for that?
I mean, I think they need to. One of the reasons why we're in the second Trump administration is because of the general pervasive sense among the public that Democrats have failed to deliver on their economic needs. And healthcare is a big part of that. But obviously, inflation in the last few years is also a big part of that. I don't think either party has credibly dealt with any of this, and I think we're going to see another ping pong match back and forth. Basically, in the last 10 elections, in 9 of those elections, either Congress has changed power or the presidency has changed power. So people are desperate; they're looking for some party to handle their problems. They go to the Republicans and then back to the Democrats and then back to the Republicans and back to the Democrats. If that trajectory continues, the Democrats are going to get another opportunity. But unless they really tangibly impact the lives of most Americans, they're going to squander that and give it right back to the Republicans again. So, the only way to break this cycle is to actually speak to the needs of the American people.
Absolutely. And that's, something that we've been covering here at Status Coup, that, it is the Democrats' fault that they have lost this because, again, as you said, they are not representing the material needs of people and not offering anything to actually affect their material lives in any way. I guess I would just ask, is there anything more that you would want to add in this conversation? Anything else in the piece that you think people should know about?
Well, it just, some of this is really technical and it's sometimes hard to grasp. But the basic thing is that we have this giant Republican bill, which represents almost all of their agenda, where they want to give tax cuts to the rich and pay for them on the backs of the poor. And it's really as simple as that. And that's, the devil's in the details, and the details are in the piece. But that ultimately, the takeaway is we're going to charge poor people more for healthcare so that we can fund tax cuts for the rich.
Absolutely. And again, everyone should go read David's piece in the American Prospect. Medicaid cuts in Republican bill would charge poor people more for coverage. Thank you so much, David, for being here with us to walk us through this. This was extremely informative. And again, everyone should go read the piece. If you like this, please do like, follow, and subscribe to Status Coup News. And if you can, please support us by becoming a paid member for as little as $5 a month so that we can keep having conversations like this and talking to people like David who are doing really, really important work. So thanks so much again for everyone who's watching this, and we'll see you all in the next video.